Chairman Casey, Ranking Member Braun, members of the committee, thank you for the opportunity to testify today. It is an honor to be with you. On behalf of Families USA, a leading national, nonpartisan voice for healthcare consumers, I want to thank you for this critical discussion. No one in America should have to choose between going to see their doctor and buying groceries to feed their family. Yet almost half of all Americans don't get needed medical care because of the cost. And 48 million older Americans fear they won't be able to afford life-saving care. Every American knows that we pay too much for the healthcare we get, but many Americans don't know why. Because healthcare industry consolidation, particularly among hospitals, has eliminated competition and allowed monopolistic pricing to push our nation's families to the brink of financial ruin. Particularly concerning is that healthcare is one of the only sectors in the U.S. economy where consumers are blinded to healthcare prices until after they've received a service and a subsequent bill. This lack of transparency is a major barrier to the healthcare sector competing based on fair prices and high-quality care. And there is no question that our nation's families are suffering the consequences. Take the story of Kunhi Lee from Mentor, Ohio. Once a year, she goes to a rheumatologist for a steroid injection in her hand to relieve pain associated with her arthritis. Each round of injections costs her $30. But in 2021, when she arrived at her usual office for her usual treatment, she found they had moved up one floor in the building. She thought nothing of it until weeks later, she received a bill for nearly $1,400. Ms. Lee's infusion clinic was moved from an office-based practice to a hospital-based setting, resulting in a price increase of more than 4,500% for the exact same service for the exact same provider. Or take the story of Ben Lose and his then 5-year-old son from Monument, Colorado. In 2022, Ben and his wife rushed their son to the doctor after he began experiencing seizures. They were referred to a specialist and received confirmation that their son's EEG scan would be covered. Weeks later, the Lose family received a bill for $2,500. When they called the hospital about the bill, they were told it was a facility fee, that the physician service was covered, but now they had to pay the hospital. Frustrated with the bill he couldn't pay and grappling with his son's health, Ben wanted answers about why this happened, but found it nearly impossible to determine who actually owned the hospital. It was a giant black box. Ultimately, Ben discovered that this hospital system raked in billions of dollars in profits just in the first 9 months of 2022, all while he was struggling to pay his medical bill. These stories are far too common in the U.S. healthcare system, particularly since the role of hospitals in our economy has shifted drastically over the last 60 years. What were once local charitable institutions built to serve the community had now become large corporate entities focused on maximizing revenue rather than improving health. Fundamentally, the business interests of the sector are no longer aligned with the health and financial security of the patients they serve. Study after study shows that privately insured consumers and employers are paying 2 to 3 times what Medicare pays for the same hospital services. Commercial insurance prices for hospitals and physician services in more monopolistic markets like Florida, South Carolina, and Tennessee cost at least twice as much as the same services in competitive markets. Take the average price of a knee replacement, which costs 3 times more in Sacramento, California than in Tucson, Arizona, or the price of an MRA at Mass General Hospital in Boston that costs 5 times more just depending on the insurance carrier. These higher prices result in higher premiums, lower take-home pay, and higher cost sharing for the more than 176 million Americans who get health insurance through their employer or directly from a health plan. Medical monopolies are forming in nearly every state. Whether it's a private equity-backed firm buying up hospitals and then cutting service lines and laying off workers, as we see is the case of Steward Health System in Massachusetts, or price gouging and suppressing wages in the case of UPMC in Pennsylvania, or the giant medical monopoly that is HCA Healthcare, which has facilities in 20 states, including Indiana, Georgia, Florida, and South Carolina. Notably, HCA Healthcare ended 2023 with more than $5 billion in profits on $65 billion in revenues, allowing their CEO to take home a salary of more than $21 million. These billions of dollars of profits are made in the backs of people like Ben Lose and Kunhi Lee, and the 1/3 of Americans who can't afford to buy groceries or pay their rent because of rising healthcare costs. Congress has used its power to rein in the corporate abuses of big oil, big tobacco, big banks, and big tech. Last year, the Senate examined how to protect people from the price gouging for concert tickets. It is past time to scrutinize big healthcare corporations and protect families in America from the greed of medical monopolies. We urge this committee to support well-vetted bipartisan solutions, including strengthening and codifying price transparency rules, implementing site-neutral payments and addressing dishonest billing, increasing transparency of ownership data, limiting harmful contracting terms, and strengthening FTC and DOJ enforcement of anti-competitive practices. This committee has a responsibility to put the needs of our nation's families ahead of the greed of big healthcare corporations. Our health isn't a game, and no one should be allowed to play Monopoly with it. I thank the committee for your time and look forward to answering any questions.